Hi, everyone. We've got a couple more minutes here. We'll wait for everyone to get in before we get started. All right, we'll give it just a few more minutes here before we get started. Let everyone get settled in. All right, we'll go ahead and get started. Hi, everyone. Thank you so much for joining us today. My name is Rachel Schluckbier. I lead the marketing team here at IWC Innovations. We're excited to have you all for this webinar today, Preventing Legionnaires' Disease Strategies Beyond Compliance. So at IWC Innovations, we're committed to not only helping facilities stay compliant with regulations, but also equipping you with practical strategies to keep your water system safe and your building occupants safe as well. And that's exactly what today's session is all about. So I'm excited to introduce our speaker today, Danielle Taladzik, who's an account executive here at IWC. Danielle works closely with a lot of our clients to help design and manage effective water safety and water management plans. And so she'll be sharing her expertise on how to prevent efforts beyond compliance. So today's webinar will run for about 30 minutes, so we'll have plenty of time for Q&A at the end. So throughout the webinar, feel free to send your questions in the Q&A box, and I'll keep track of it, and then we'll kind of go through those Q&As towards the end of the session. So with that, I'll pass it over to Danielle.
Thanks, Rachel. Hi, everyone. Thanks so much for joining us today. Like Rachel said, my name is Danielle Taladzik. I support all things water safety here at IWC Innovations. Legionella testing, waterborne pathogen testing, water management plans. A little bit of background about my personal journey in the water world. I started as a lab analyst in 2017 at the Special Pathogens Laboratory that's located here in Pittsburgh, where I live. That was a pivotal time in water testing. There was a lot of newer regulations that really created a surge for the need for water testing across many industries. While my background's in biology, my passion for customer service led me into the consulting side of the business. August is Legionella Awareness Month, so it's a great time. Oh, sorry, Rachel, you're good. Leave it on there. August is Legionella Awareness Month, so it's a great time for this conversation. Legionella management has been a significant concern for facilities and is only becoming more of a focus. This recent Harlem outbreak and associated preventable deaths is a reminder of why we must remain vigilant. While regulations and checking those boxes is critical, that can only take us so far. In today's webinar, we'll focus on why taking proactive approach to water management is essential, how making informed decisions can keep your building system low risk to protect not only your building occupants, but also the surrounding community. So, what is Legionnaire's disease? Legionnaire's disease is a serious type of pneumonia caused by Legionella bacteria. Primarily affects the lungs, but can also lead to complications like organ failure if it's not treated quickly. Treating with the proper type of antibiotics is critical. That's why clinical awareness is very important to detection. In order for an individual to contract Legionnaire's disease, there has to be a source and an exposure. The bacteria has to make its way into the lungs either by breathing in aerosolized water droplets that contain the bacteria or aspirating, coughing when you take a sip of water that contains Legionella. The incubation period, or when you see the onset of symptoms, is 2 to 14 days after exposure. Symptoms include fever, cough, muscle aches, and shortness of breath. I want to highlight that this is a waterborne illness and it's spread through contaminated water systems. It does not spread from person to person. About 10% of community-acquired cases of Legionnaire's disease can be fatal. That percentage goes up from there. In healthcare-associated settings, because the opportunistic pathogen attacks susceptible hosts, older adults, smokers, people with chronic diseases like diabetes, immunocompromised individuals, they're all more susceptible hosts. Mortality is cited as high as 30 to 50% for someone who's immunosuppressed if the disease is left untreated. Here's the good news. Legionnaire's disease is preventable. Understanding how and where Legionella colonization develops is the first step towards controlling it. And that's what we're here to focus on today. What is Legionella? Legionella are naturally occurring bacteria found in freshwater environments like lakes, rivers, and streams. On their own in nature, they don't generally pose a problem, but once they make their way into a man-made water system like a cooling tower or large plumbing network, they can multiply to dangerous levels under the right growth conditions. There are over 60 known species of Legionella, with about half having been linked to human disease. But the most concerning, the big bad wolf that we're always on the lookout for, is Legionella pneumophila, which is responsible for the majority of Legionnaire's disease cases, specifically serogroup or serotype 1, which is responsible for roughly 90% of LD cases. Identifying the specific species present in your system, which can only be achieved through testing the water, can help guide the right corrective actions and response strategies. Legionella can grow in many types of water systems. Cooling towers can be a major source, and they are the confirmed source of the ongoing Harlem outbreak. The warm water recirculates in the tower along with environmental nutrients and can be ideal for bacterial growth. When the system operates, it can release droplets into the air for miles around the tower, and if contaminated, these droplets are infections when inhaled. Hot water heaters, storage tanks, especially if temperatures aren't consistently maintained outside of Legionella's optimal growth range, can be a breeding ground. The same goes for large plumbing systems where water can stagnate in unused areas of the building, like potential dead leg sections of pipe. Decorative water fountains, water features, definitely hot tubs and spas, they've all been linked to outbreaks, particularly when system maintenance and disinfectant levels are inconsistent. An overlooked source of Legionella bacteria are ice machines. The units have like very small diameter tubing that creates a great substrate for biofilm growth. Medical devices like CPAP machines, humidifiers, fans, and misters are all overlooked sources that create aerosols. And if they're filled with contaminated tap water, they can spread Legionella if they're not operated according to the manufacturer's directions and properly maintained. The key takeaway is that any system or device that stores and circulates water has potential to spread Legionella if not properly managed. Let's talk about the real world, real-time example that's going on right now, the 2025 Harlem outbreak. It's got everybody Googling Legionella, much more national news coverage on Legionella right now. The first cases emerged in around July 25th and centered over several Harlem zip codes. Less than a week later, the New York City Department of Health and Mental Hygiene had already confirmed 22 cases and 1 death, prompting the urgent investigation. As the outbreak is evolving, the total numbers keep climbing. We're over 100 confirmed cases with 6 fatalities as of this morning. Investigators have identified the likely culprits, which are 12 cooling towers that tested positive for Legionella pneumophila. These towers have been remediated and disinfected to prevent further spread. Scientists are using DNA to determine which towers may have made people sick. This is all too similar to the 2015 Bronx outbreak, with 120 confirmed cases and 15 deaths. In response at that time, New York City officials enacted strict regulations for cooling towers, Local Law 77, which included registration, inspection, water testing. Several of the implicated towers are actually owned by the city itself. So this outbreak shows that regulation, while important, is not enough on its own. Preventing Legionnaire's disease requires strategies beyond that. Regulations differ per industry and area. We have CMS and ASHRAE Standard 188 that are the most widely known, and many of today's attendees are directly affected by these standards. Additional regulations, like the just mentioned Local Law 77 in New York City or the newer enacted New Jersey S2188, plus many more. If you have questions on what regulations apply to you, please reach out to IWC. We're a nationwide consultant and service provider, and we can help ensure that you're compliant with regards to water safety and Legionella testing. Preventing Legionella bacteria growth isn't about one single measure. It's about a comprehensive program that addresses every point where water can become a risk. Today, we'll talk through the core water management practices: system design and maintenance, temperature control, cleaning and flushing, risk assessment and water management programs, proactive testing, corrective measures, and finally, education for everyone who uses and manages the building. Water system design. Good design is a foundation of prevention. Systems should be designed to keep water moving, avoid unnecessary loops or dead ends, and allow easy access for maintenance. Plumbing material selection matters, size matters. Oversized pipes and systems can lead to stagnation. Undersized systems can have pressure issues. Once a system's in place, consistent inspections and preventative maintenance help catch potential issues like corrosion, biofilm buildup, failing components, all before they become health hazards. If your building makes system modifications during renovation projects, it's important to always consider how those changes are going to affect the system design and the flow of water. Remove any unused piping. Even just a few inches can harbor Legionella. Temperature control. Legionella bacteria grow across a wide range of temperatures, but they thrive best in warm waters between 77 and 113 degrees Fahrenheit. Growth slows outside of this range, but it doesn't stop entirely until the temperatures are much lower or much higher. Below 68, bacteria become dormant but still survive. And then above 122, we start to see inhibition of the growth. When we reach 140, about 90% of bacteria are killed within 2 minutes of contact time. As we approach hotter temperatures, just above 150, we get rapid kill where the bacteria die in seconds. Above 160, Legionella is eradicated almost instantly. So we need to maintain storage temperatures of at least 140. If 160 can be achieved, even better. Your target delivery temperature should be above 124 or at the maximum that your scald protections allow. A master thermostatic mixing valve will allow you to heat to this target, then down mix to your required delivery temperature. Also ensure that recirculating systems, the water sent back through the heating tank and not just mixed back into your cycle to reheat. Cold water should remain under 77 degrees Fahrenheit. In areas where this can be a challenge due to high environmental temperatures in the summer, ensure that pipes are well insulated and once water is on the premises. Design the plumbing systems with the cold water pipes as far from the hot water pipes and other heat generating systems in the building as possible. As with all things, we have to acknowledge limitations. If you're provided water that might already be in the ideal bacterial growth range, you have no control over this parameter. So we have to focus on other elements to help control. Temperature control is only one tool, not always feasible. It's important to measure, log, and review temperatures regularly. This will allow you to catch issues early on and also understand where you may have seasonal adjustments needed to your water management practices and inform how we can layer protective measures. Now that a system hopefully has hot water that's hot and cold water that's cold, we have to keep the water moving. Stagnant water is an open invitation for microbes, pathogens and non-pathogenic bacteria alike. When biofilms are given the opportunity to develop, they can provide layers of protection to Legionella, which the typical disinfectant levels supplied by your municipal water provider cannot combat. The Safe Drinking Water Act allows for the addition of oxidants up to only 4 ppm, which is not high enough to eradicate Legionella completely from the water. The low levels of bacteria entering the system will become a risk if allowed to proliferate through stagnation. Regular flushing of infrequently used sinks, showers, and other low-use outlets like emergency eye wash stations keeps fresh water with maximum disinfectant levels moving through the system and physically disrupts biofilms that might establish on the pipe's interior surfaces. Components of your system should all be cleaned on a schedule to reduce scale and sediment buildup, which can shield bacteria from disinfectants. Something that's often overlooked are faucet aerators. These small mesh screens can trap organic matter and sediment, creating a breeding ground for bacteria, including Legionella. If not cleaned or replaced regularly, aerators can reintroduce bacteria into the water system and increase exposure risk. You can also consider laminar flow attachments as a replacement to traditional aerators to reduce aerosol risks at the sinks. A formal water management plan is the backbone of Legionella prevention. It starts with creating a flow map of your system, identifying where risk exists, and putting control measures in place for those risks. Documenting all activities not only supports compliance, but helps spot trends before they become problems. For our healthcare attendees, your surveyors have been asking to review your water management plan documentation. We are seeing increased scrutiny across the country. Having a dusty binder on the shelf will not cut it. Your plan must be current and actively implemented with the documentation to prove it. If this sounds like a big step up from your current program, IWC can help. As a nationwide Legionella consultant, our Water Management Plan Task Hub provides scheduled reminders and centralizes the record keeping to make the whole process painless and efficient. Validation testing is essential. About 50% of buildings harbor Legionella. Without testing, you won't know if your control measures are working. Testing allows for adjustments, whether you're adjusting your water management strategies or implementing temporary supplemental disinfection. Having laboratory results, preferably from a CDC Elite certified laboratory, allows you to address potential issues thoughtfully. If Legionella is detected in your system, don't panic. Early detection gives you the opportunity to address the problem proactively rather than waiting until it escalates into a costly and higher risk reactive situation. You stay in control, make informed decisions, and avoid the rush choices that often accompany a case investigation. If you're waiting for a clinical case to test your water, it's already too late. IWC provides site-specific, comprehensive Legionella testing programs tailored to your facility. Contact us when you're ready to get started with your water testing. And if you're already dealing with a reactive case investigation, should have already called us, but it's okay. Reach out as soon as possible because we can assist you. We can support these challenging projects with our experience working with departments of health across the country and our shared public health goals. So what happens if poorly controlled levels of Legionella are detected in your system? 0.2 micron point of use filters are a great short-term control measure. They're installed right at the faucets and shower heads to physically block bacteria from passing through. These filters are especially valuable in hospitals, nursing homes, and facilities during outbreak investigations to protect vulnerable individuals and prevent additional exposures. While they don't solve the root problem in the plumbing system, they buy time to address the bigger issue and provide peace of mind knowing that while the system may contain Legionella, a barrier between the contaminated water and the people using the sinks and showers. IWC also recommends this style filter be installed on the supply lines as a preventative maintenance measure for ice machines in all facilities. They provide protection to remove ice as a risk factor and only need to be replaced every 6 months. The carbon filters that are often installed on ice machines are for taste improvement, and they actually strip chlorine molecules from the water, creating a more conducive environment for bacterial growth. So the two types of filters can even be installed in sequence to give you the best of both worlds. We're happy to review your current setup to ensure best practices are in place. Now let's address those root causes. We have to understand what elements of the system contributed to the colonization. And then as those things are being addressed, the system needs to be reset to a clean starting point. The chemical shock treatment or hyperchlorination is effective as an immediate correction, especially during case investigation and response. When we have a lower risk situation, but still have a system that requires cleanup, our HydroTreat temporary disinfection cart is a great solution with no system downtime. As Legionella growth management is a journey, some systems at the end of the process will require permanent installation of supplemental disinfection. IWC can walk through this process with you to ensure the correct approach for your mitigation efforts. Even the best plans fail without team contribution. Train your maintenance and facility staff so they understand both the why and how of each control measure. Water safety cannot rest on one person's shoulders. It requires collaboration across departments and leadership buy-in. Everyone has a role in water safety. Fostering ownership of the water management across departments decreases risks. Your program team should include as many backgrounds as practical for your facility: engineering, infection control, administration, operations, and beyond. We also need to educate building occupants and residents, especially in healthcare and senior living settings, so they can report problems quickly. When there's a suspected issue or case investigation, clear, timely communication is key to maintaining trust and safety. With proper education in place, your team is prepared to respond when unexpected events occur, like pressure drops or water main breaks that cause biofilm sloughing to release bacteria in the system, creating exposure risk. The immediate response should be to increase flushing of the outlets and restore disinfectant levels and move fresh water through the system. The key point here is education and preparedness ensures quick, effective action to minimize risk. IWC offers site-specific Legionella awareness and risk mitigation training that can be tailored to the audience, ranging from high-level overviews to in-depth technical sessions. In many cases, the programs also meet internal compliance training requirements. The goal is not zero detections of Legionella in your environmental samples. The goal is 0 cases of Legionnaire's disease. Legionnaire's disease is preventable. True protection from Legionella comes from forward-thinking management by an educated and engaged team. Water management plan implementation, regular testing, and making data-driven decisions will help you stay ahead of risks. The good news is that most of you listening today are in a proactive position, not in the middle of an outbreak. Now's the time to audit your systems and strengthen your prevention strategies. At IWC, we partner with you, helping review your data, review your water management program, and train your staff. Truly customize the programs to your needs. Don't wait for a Legionella outbreak to force your hand. Take control now to protect both your facility and the people in it. Now I think we have time for the Q&A. So Rachel's going to help us out with any questions that are in the chat. I'm going to do my best to get back to them, now in real time, but we might need some additional IWC team member input. And if that's the case, we can follow up with you after the webinar.
Yeah, thanks, Danielle. A couple questions that came in. What do I do if the Department of Health contacts me with a suspected case of Legionnaire's disease in my building?
So there's a lot of things you need to do at once, right? Whenever you first become aware of a case investigation, and a lot of times our customers call us before, the Department of Health contacts them because they've become aware of the case through the family of the affected individual or by some other means. So the first step is to assume that we have contaminated water in the system because we don't know the status of the water, even if they've recently tested, even maybe they tested last quarter and there was no detections at that time. So we want to implement water restrictions by getting point of use filters in place and just do anything we can to prevent additional exposure so we don't end up with a larger outbreak. Then we need to test the water. So we'll follow a CDC compliant sampling plan so that we get a really comprehensive idea of what's going on in the system that's kind of centered around if this is a resident, if the person having the case investigation lived in this building. It's a little bit different for community acquired situations, but we need to test the water and then go from there. If we see detections, we can implement some of those corrective measure strategies we talked about earlier. If we don't see detections, that doesn't mean that's the end of this case, right? Those sampling events are a snapshot in time. And so the conditions that may have been the exposure back whenever somebody was infected might not be exact same conditions on the day we sampled. So we still want to do a full risk assessment of the system, make sure they have a water management plan in place and are implementing it, and then, correct proactive strategies moving forward. So what you should do, sorry to answer your question, is call us so we can help you with each one of those steps.
Another question we got is, what is the process to get my water tested at my facility? Is it a government entity or a private company?
So to test your water at your facility is on you, building ownership, building management. So you would contact IWC or any other water consultant or water testing laboratory and let them know that you want to test the water, but it's not done through the government. It's done through private businesses.
We've got another question. How often should you change or clean aerators?
So most of our water management plans, especially in the healthcare setting, we default to quarterly for that control measure. Some facilities, know that they have hard water and there's reasons we might want to do it more frequently, or very soft water and there's not an issue and maybe we could back off and do that twice a year or annually, but quarterly is kind of the default recommendation there. And in some tricks where it's like an impractical job, we kind of recommend maybe having 2 sets for the building, right? So whenever you're going around, you can swap in the new clean aerator and then clean the ones you just took off separately and then have them ready to go for next time. It makes the job a little easier.
Kind of in the same vein, how often should you flush stagnant areas?
So at least when we have infrequently used fixtures, we want to simulate regular use, right? So we would say at least weekly or bi-weekly if your labor if that's more practical for you. But you have to treat that outlet as if it's being used, right? So for eye wash stations and emergency showers, those can be a little less often, maybe monthly, but for a bathroom sink, shower sink, especially in higher risk areas, healthcare settings where we have susceptible individuals, we need to be flushing weekly or bi-weekly. And another, some tricks that we also tell people for that is if you're in the room for another reason, housekeeping might be in there weekly doing cleaning or some other rounds where you're doing checks, add the flushing at that time. That way it's less, it's not a brand new job. We're just adding to an existing job on the rounds.
We've gotten a couple questions just around the cadence of performing Legionella testing and specifically nursing homes and long-term care facilities. So what's the recommendation of how often they should be testing?
Sure. So that's one of those ones where your locality has different regulations. So your building, where your building sits and the type of building that you are, if you're a skilled nursing facility versus an independent living facility or a hotel in a certain state, you all are, have to comply with different regulations. But on a national level, just in general, we would say we need to be testing it at minimum annually. If you're not obligated to test more often or at all, right? There's lots of buildings that aren't obligated to test in any capacity. Let's start off with annually. You really need a baseline. Your baseline is going to help you understand what your customized testing program is. If you have no detections, that's a good thing, right? Let's continue to implement our water management practices that exist and check again maybe next year. If we have some low-level control detections, that's something we're going to want to keep an eye on so we can spot check maybe quarterly. And then if you start with a more risk-averse strategy where you test quarterly for a year, have no detections, then you can kind of back that off to maybe biannually and annually as you get to know what's going on in your system. Make, like we said, data-driven decisions to inform your testing program.
Aside from cooling towers, what else is commonly tested?
The potable water system. So the hot water tanks, you want to get a drain from your hot water tanks, sinks and showers. Showers are a much higher exposure risk than sinks for the aerosolization. You want to get, if you have an access point to a hot water recirculating loop, if you have a large centralized hot water system, that's good because that's going to tell us what's getting, cycled around through the building. We do recommend testing on warm water more. That's a more likely source than the cold water side. But also your incoming cold water, you want to test that just to see what's coming into your building.
Let's see, we got a couple questions on filters. Do you recommend the point of use filters for regular use as a prevention method?
It depends on the facility and the building. So of course, a filter in place will ensure that the user of that outlet has no exposure to waterborne pathogens, including Legionella. But they also do reduce flow. So you need to be careful that if you have filters in place, you're still implementing a flushing program that's keeping water moving through the pipes in the way that they were designed. You don't want to accidentally increase stagnation in other areas of your building by having the point of use filters in place.
We had another question regarding aerators. What is the best method for cleaning aerators?
So just a bleach solution, 1 to 2% bleach solution in a bucket, and put those in with a wire brush and just make sure you're breaking up any of the scale buildup that's on those. Again, they're not extremely expensive, so if it feels like it's too far gone, we would recommend replacing with a new one. Those laminar flow aerators that I mentioned are fantastic. The way they create the cyclone of water does reduce the risk of aerosolization right there at the sink.
We got another question for how do you identify low used outlets and faucets?
So that's when you got to bring in the team, right? That's why you can't just have one person that's in charge to manage the water safety of the building because they might not have access to that information. But you need to, if it's a healthcare space and you have your building occupancy records, just monitor if there's not a resident in a room for a week or two, assume that that outlet's not being used. And you can also like learn about them by testing the residual disinfectant at distal points throughout your building. If you go up to an outlet, test it, it's not the right temperature and it's not the right disinfectant, but the outlets down the hall are in the range that you want them in, that probably means that there's some stale water in that outlet and it needs flushed.
Is there a recommended chemical treatment to prevent Legionella specifically in holding tanks?
So if you have an ongoing issue with that holding tank, we might need to look into that further. But there's lots of technologies and chemicals that would be able to treat a hot water system or a cold water storage tank. Whether it's like a one-time event clean out, like we said, like that hyperchlorination where we're going to achieve a higher ppm for kind of a shorter few hour hold time, or if it's a lower level supplemental where it's just an ongoing process, but they would treat the tanks, yes.
Just a couple more here. Who should be on the water management team in my facility?
As many people as you can convince to join the team. We actually, it's kind of, a sad point for us where we're just very often only working with the maintenance director of a facility or the maintenance staff or the engineering team, whenever we really would like to see that to be a more comprehensive group that has all of your operations. If it's a healthcare, say somebody from the clinical side, so that way it is team effort and it's multifactorial, so we know that we're really addressing things, or maybe you're not overlooking things. But yes, please, not only one or two people. If we could have 3, 4, 5 members, and then knowing if you have an IWC team, we're not an official member of your program team, but we are there as consultants to answer any questions that come up during its implementation and review it and make sure it's still compliant.
Okay, what is the difference between Legionella bacteria being present in a system and it actually causing illness?
Yes, that's like back to the don't panic if you
Didn't get that.
Oh,
Could you try again?
Siri's answering us. But if you test the water and you kind of, some people want to be the head in the sand and not know what they don't know about their system, but testing is the right thing to do so that you can respond to what is going on in your system. But if you have lower level detections, under 1 CFU per ml is considered well controlled following CDC guidelines. We can continue to follow our water management practices. But if we get, above 1 CFU, 1 to 10 CFU per ml, there's some adjustments are needed. And so depending on what outlets you tested, we might recommend an expanded sampling to understand if we have a systemic issue or maybe just a fixture specific issue, so we can have the best strategy to correct it. And maybe we do need point of use filters while we're figuring that out or while we're waiting for more information. But somebody contracting Legionnaire's disease, it has to be exposed. So that means it has to get into their lungs. Even if you take a sip of water that contains Legionella, but it goes down the right pipe and into your stomach, that's not going to create an issue, and susceptible hosts. So thankfully, luckily people that might be exposed in a normal setting, if they're otherwise healthy individual, should not pose a problem for them. So that's why we have so much activity in healthcare space with the elderly and people that are compromised and more susceptible, and buildings that might have low use, right? It's really the perfect storm. So we just have to look at all the factors when we're reviewing the reports. If we have a detection, we just got to look at all of that, including the speciation, right? We talked about that Legionella pneumophila is much more associated than the other species of Legionella. They have been associated with disease, but they're not as concerning, right? It kind of gives us the information that conditions might be favorable for pathogen growth in that system, but we don't have the scary pneumophila yet. So it's good timing to make adjustments.
And then what about water softeners? Do they affect the possibility of harboring bacteria as well?
Absolutely, yeah. So the water softener is, essentially a storage bed for the water, and it needs to be properly maintained and serviced per that tank's instructions. We've seen a lot of stories with buildings we're working with that maybe have been completely cleared of Legionella, from hyperchlorination, and they had a softener that was bypassed for a while that did still have water in it, put it back online. All of a sudden, we've got Legionella back in the system because it was just hanging out kind of in that storage ready to go. So yes, your softeners need to be maintained properly to not allow them to harbor Legionella. And also, if you're making adjustments to putting things on and offline for your system, you have to consider, its proper layup process.
What are the signs of being sick with Legionella in the body? So Legionnaire's disease.
Legionnaire's disease, so it's a very high fever. I have to admit, I'm not the most versed on the clinical side of things, but it is a pneumonia, right? So we do see misdiagnosed of other pneumonias, and that's why I said it is important to treat with the proper antibiotics, because some of the generally prescribed antibiotics for pneumonia are not effective against Legionella. But yeah, so on the clinical, I'm going to have to get back to you, but I do know it's a respiratory issue, high fever, coughing, and lingering. And then we see those symptoms, like we said, 2 to 14 days after exposure. So that's why when we do have somebody who is symptomatic with any respiratory conditions, we look back at where they were in that 2 to 14 day period for potential exposure sources.
We had another question about water heaters. Is a tankless water heater a better option?
Tankless water heaters, we see issues with when they don't get up to temp, right? We talked about those temperature control ranges, and we want to make sure we're achieving 140 quickly enough to eradicate any bacteria that might be in the system.
And then I think you already answered this question, but it came in again. For a skilled nursing facility, how often do you recommend Legionella testing?
Yeah, so yeah, it depends on where you are, but we'll say minimum of annually. IWC does give our baseline recommendation a little more risk averse of quarterly.
Perfect. We had a couple of questions come in just about getting a copy of the PowerPoint. We can definitely send out a copy of the PowerPoint when we wrap up here. It'll probably come out tomorrow. And then we also had the question of where we were located. So IWC Innovations, we are headquartered out of Indianapolis, Indiana. But like Danielle mentioned a couple of times, we are nationwide. So we do service the entire country. I think that is it for questions. We'll hang on for another minute or so if anybody has any last few questions that they wanted to ask.
And then we'll get back to all the questions via email or personal phone calls after this.
What does it mean if your test results come back as no result from lab?
So each lab is different. There's probably a footnote on that result that says something regarding like bacterial or background flora, right? There might have been a lot of other bacteria in that sample that didn't allow the Legionella the opportunity to be detected. So they can't quite call it not detect. Doesn't mean that the Legionella is there or not there. It meant that the sample itself from the method that they use, they're not comfortable kind of calling it one way or the other. Depending on the source of that sample, it probably could use a cleaning otherwise, right? So even though the bacteria that might be growing in it isn't pathogenic, still shows there's something going on there where we've got a lot of growth.
We had a question about the, oh, they're all coming in here. Let me see. I see the disinfection cart. How would you make the necessary connections to the building water system?
Oh, yep. So we just need an injection port. Ideally, right now, every mechanical room has its own unique challenges for us, but we want to go in the incoming supply line past your backflow prevention device where the water, arrives in your facility. We would need an injection port there. And then we also need an injection port 15, 20 feet down the line as a takeoff valve to give our system feedback, right? So that we know we're treating and then it's going back. And that's for the cart specifically. For hyperchlorination, you just need that one injection port, common hose bib or valves. It's an easy plumbing modification if your system doesn't have something we can work with installed.
We had a question about filters for ice machines. Are there specific filters that are needed for an ice machine or a special filter?
Yeah, so the 0.2 micron is the pore size that's going to prevent bacteria from passing through into the machine. That's why just as general practice, I think, they're low costs for something that your facility is only going to buy every 6 months. You probably do have a charcoal carbon filter in place there, which is in no way preventing pathogen growth or biofilm growth inside the machine. So if you put the 0.2 micron on and you have your ice machine cleaned from a professional vendor, you're at a nice clean starting point. You've basically removed that as a risk factor. The ice cubes won't contain bacteria in them. And the reason, ice, it's colder than that growth range, right? But the Legionella still can be dormant in there. And so if it melts in a cup and then somebody takes a sip and aspirates or chews on it, it can be an exposure source. There's other microbes too, other than Legionella, that really love ice machines. So it can be dirty places.
Are there test kits that can be purchased and performed in-house?
Yes. So IWC can support your testing through self-collection or on-site collection. We can dispatch a tech to come in and help figure out where we think the ideal places for the sampling plan are, or we can remotely assist you with developing the sampling plan by asking questions about your system and reviewing floor plans. And then we just ship a cooler that contains the sample bottles right to you. It contains all the paperwork you need. We can even pre-fill that with the locations if we discussed it ahead of time. And so it's as easy as opening up the bottle, putting it right under the outlet that you're collecting, open and filling up a bottle with water. You're going to put it right back into the cooler that we provide to you, take it to FedEx the same day and send it off to the lab.
And then we've got one, is there a certain way to collect the sample? So can you tell us what the best practices are when collecting a Legionella
Sure. There's
sample?
a couple schools of thought on the best sample collection. Our recommendations are going to be for first draw when you're doing baseline sampling. The reason for that is we want to represent the highest risk that the user of the outlet would experience. So if they went up to wash their hands or take a shower, they're going to turn the water right on and whatever's there is going to be exposed to them. So if you do a long flush beforehand, some people might want to do a 3-5 minute flush. That's good information, but that's different information. That's telling you about what's happening further back in the pipe that's coming to that outlet. And like I think I said earlier, we want to mostly collect warm water samples because it's more likely that if we have a colonization or a fixture issue, it's going to be on the hot water side.
Perfect. I think that wraps up the questions we have. I do see a lot of people asking to send the PowerPoint deck to certain emails, so we'll make note of that. Oh, we have one more coming here. Do you test for other harmful bacteria?
Sure. Yeah. So yeah, Legionella is definitely the primary, the rock star at IWC that we talk about day in and day out, and all the case investigations that we're working. But there's other waterborne pathogens that we can assist you with testing and remediating. Non-tuberculosis mycobacterium, Pseudomonas aeruginosa, harmful metal levels, right? Lead and copper. We can assist with anything you're concerned about going on in your water systems.
Awesome. Perfect. Okay. I think that concludes the Q&A.
Cool. Well, like I said, I saw lots of questions coming through. We'll get back to everybody. Rachel, you have that FAQ to send over after this. So thank you everybody today. Yeah, we're going to have a FAQ guide emailed to you in the next few days for download. And then any other questions you have from this presentation, from the FAQ guide, beyond that, please reach out. You can call me directly. You can call the IWC main line. If you select several options, will ring right to me. And there's that info@IWC Innovations that Rachel will make sure makes its way to me. So I just want to thank everybody for showing up today. To the existing IWC customers that are here, thanks so much for your ongoing efforts to combat this preventable disease. And I know we have some Department of Health friends that are here. We appreciate your continued collaboration to protect the communities. Anybody that's new to IWC, it's great to meet you, and we can't wait to help you with your water safety journey.
Awesome. Thank you so much, everyone. Like I said, we'll get an email out in the next day or so with a copy of the slides. And we also, like Danielle mentioned, we do have FAQ guide that will be available for download as well. So thank you again for coming. We really appreciate everyone's time today.
Thanks, guys.